In this video, I'm going to talk about why us guys in nursing must go to the gym and work out. Let me try and list 2 reasons. These 2 reasons will be enough to get you to the gym. Number 1, less chance of injury. Sure, we are all trained to always use proper body mechanics. The problem is always time and short staffing. I know, you know, that nursing is sometimes insanely busy, especially that first 2 to 3 hours of your shift. Getting patients up to the bathroom, then to the chair, maybe washing them up, giving medications, and then finally setting their breakfast tray. This is a big problem when you have multiple patients who need all that help. Inevitably, there will be times when you can't wait for a coworker to help you to get a patient out of bed. I mean, of course, if a patient is totally mobile, of course you can't do anything but to wait for help. But I'm talking about the patients who are right in between dependent and independent. Patients who technically can get up out of bed with one person assistance, but with great difficulty. And for a person who is as impatient as me, I'm getting them up with increased risk of injury to myself. And of course, I've had sore lower back muscles after certain shifts. And I would think to myself, frick, this nursing job is really as tough on the body as they say. But after a month of going to the gym and building my strength, I've realized that it's not nursing that is tough on your body. I mean, it is, but mostly because my body was just so weak. I remember doing deadlifts for the very first time in the gym with pretty good form. I trained for maybe 45 minutes total, meaning maybe 30 minutes of actual training and 15 minutes of total rest time. Even with that little of a training time, I could not go back to the gym for 7 days because my legs and back were so sore. My body has never felt anything like this before. Getting up out of bed the next day was a struggle, let alone going up and down the stairs. This is when I had a revelation. Wow, I'm weak. So very weak. But the good news is that your body gets accustomed to exercise very quickly. When I was finally not sore anymore, and I did the same amount of deadlifts for the second time, I mean, of course, I was sore the next day, but at 50% intensity, and it only lasted 3 days. You will be surprised how fast you will be able to progress in your workouts, especially as a beginner. And you can guess how this helped my nursing. Stronger back, stronger legs. Not only was I more comfortable helping patients mobilize out of bed, but I was also picking up fallen patients up from the floor. And I was moving patients out of wheelchairs to beds when there wasn't a mechanical lift available nearby. Of course, using as best body mechanics as possible. And I assure you that you will notice a marked decrease in whatever body ache you had or have going on right now. Number 2, confidence. I'm going to get really honest here. I'm sure many of you have come across exercise videos on YouTube. What do they all say? The same cliche we always hear. You work on yourself, you get better, and therefore gain self-confidence. Sure, that's good. But do you know the real reason for increased confidence? It's very simple. You have become better looking and stronger than others. That's it. Let's not lie to ourselves. We all have looked at other men who are taller, who are smarter, who are better looking, who have beautiful wives or girlfriends, and we have uttered these words under our breaths. Damn, I bet this guy is so popular with women. Shit, look at me. I'm freaking nothing. What would it feel like to have a girlfriend like that? I'm sure most of us thought something like this at least once in our lives. Similarly, I'm sure I'm not the only one who gets self-conscious when walking in public. Whenever I notice anyone looking at me, I used to think, oh shit, is my hair not perfectly styled? Are they thinking how ugly I look? Can they also notice how big my head is? You have no idea what bigger muscles and bigger body frame does to your psychology. When you get stronger, with visible improvements in your muscle size, your thinking makes a 180-degree turn, to the point where I admit I become too full of myself. Nowadays, in public, this is the funny part. Whether or not people are actually looking at me or thinking about me, I sometimes find myself fantasizing that they are. I'm sure he wishes he were as big as me. Or, yeah, that's right. I take good care of myself. You like what you see, hey? Yes, I sound kind of retarded when I put it this way, and of course I'm exaggerating a little bit here, but I hope you can tell the difference of the general aura, the general atmosphere and attitude of my psyche. You have no idea how important this is when you are in a career that deals with people all day. All the coworkers you work with, women, I believe they sense these little changes in aura straight away. But even if I'm wrong, and this is all in my head, that's exactly my point. In my head, I am convinced that my coworkers see me differently, and that gives me more confidence and happiness. And when you show this happiness and confidence, people really do treat you differently than before. I've experienced this change firsthand. This was me before working out. And please excuse my ridiculous posing, but this is me now 6 years later. I don't think it's a coincidence that I found my wife after I started working out. It's the weirdest thing. You might think us men need more feminine traits while working in a female-dominated profession like nursing, but I have found that the answer is the exact opposite. Trust me, you don't want to be treated like a feminine coworker. Keep as much masculinity as possible in this field of nursing. Couple that with good nursing work, and then you will truly become a well-respected man. My next video will be about what kind of mindset you need to have when working as a nurse. If improving your physical body helps 65% of your work life, the other 35% would come from what kind of behavior, personality, work ethic you have. Thanks for listening.